Hey guys, this is Curtis Alexander. I'm a pharmacist. In this video, I want to go over the prescription medication called Entresto and discuss in this video just the side effects. But real quick, a little background on Entresto. So it's a medication that's used to treat chronic heart failure, and particularly that type of heart failure that's involved in the left ventricular ejection fraction when that's low. And that's basically the volume of blood. That's how they calculate the amount of blood that's being pushed out of the ventricle in the heart. So it's got kind of a niched use. But like I said, I want to cover the side effects. And to do that, I think that it's important that you understand how it works in the body, and then the side effects will make a little more sense. So Entresto is actually two medications in one. So there's sacubitril, which is actually a prodrug, and that means it gets into your body. Your body has to break it down into the active drug. But when it gets into your body, some of the things that it does is it causes your blood vessels to dilate, and you see an elimination of more sodium in the urine. The second drug is valsartan, and valsartan has been around for a long time. By the way, these are generic names. Valsartan's been around a long time. Now, one of the things it does, well, the only thing it does, it bumps angiotensin II from a receptor. And what that means is that when that happens, your body is not able to, through this process, to constrict the blood vessels. It's not able to release a compound called aldosterone. It's not able to release catecholamines like adrenaline, those sorts of things. It's also not able to release AVP, that stands for arginine vasopressin, and it's an anti-diuretic hormone. So a diuretic hormone would cause you to pee, anti-diuretic causes you to not pee. So that'll become important a little later as we go through the side effect. So hopping right into the side effects, what could you see if you're on Entresto? Obviously, one of the biggest ones is you could see hypotension or low blood pressure. That shows up in about 18% of people. We can also see the second most common thing is an increase in serum potassium. We see this in roughly 16 to 18% of people. And one of the reasons that's going on is because we don't have as much aldosterone being released into the system. So we do see an increase in serum potassium. Sodium and potassium are very tightly tied together. Then we have an increase in serum creatinine. So we were talking earlier, when you see a decrease in AVP, it basically means you're not peeing as much, so we see more serum creatinine. So in the description on the video, I talked about some of the folks that we want to be careful with using Entresto. This is going to become important when we do that. The next thing is cough, and I forgot to put down cough. We're looking at roughly 9% of folks. That's related primarily to the valsartan. Also, we can see dizziness around 6% of people. And again, the dizziness is related to some of these vasodilation, those sorts of things that are going on. So those are the 5 main side effects. Are there other side effects that are possible? Yeah, of course there are, but I like to focus on the main ones. And again, in the description, I mentioned that there's 4 groups of people that I would be careful to use Entresto in, and the 4 groups are as follows. First of all, we want to know your blood pressure. If you have a systolic blood pressure less than 80, want to be very careful using that. Next thing is, do we see a decrease in serum sodium levels? If we see a decrease in serum sodium levels, problematic, something we want to keep an eye on there. Also keep an eye on people with diabetes, which kind of ties into number 4, poor kidney function. A lot of diabetics do have poor kidney function, so those things do tend to go hand in hand. Entresto is not by any means a common medication, but it is one that is beneficial, but you also have to keep an eye out because some of the side effects can be problematic. So if you have questions, post them in the comments. Also post in the comments if there's other videos that would be helpful for me to cover. You know, I love to hear those things. It helps me make sure that I'm putting out videos that are helpful for you. So until the next video, this is Curtis Alexander. I'm a pharmacist. And again, till we get to the next video, have a good one. Thank you.